Hello, it's Dr. Jon Perlman, Beverly Hills plastic surgeon. I thought it might be interesting to take a couple of moments to discuss with you an interesting subject, at least interesting to people who feel that they're overweight, and that is, when is it a good time to do liposuction? And equally, when is it not a good time to undergo liposuction? So many people I see come into my office and they feel they're heavy, they've got excess fat, and many think liposuction may be the answer. Well, for some it is, but for others it may not be the ideal approach. We all know that we should maintain approximately, be within 5 or 10 pounds, let's say, of an ideal weight. Maybe 5 pounds would be more precise. And exercise, eat healthfully, watch your diet. And if there's extra fat, then maybe consider liposuction of an area. But for many, that just doesn't prove to be feasible. I've had some patients who go to the extreme of dieting and exercising fastidiously, convincingly so, even those who have been on diet pills prescribed by physicians who just can't get weight off. And that's exceptional. Maybe I've met about 6 patients who would be categorized as such. But for most people, we wax and wane in our diet and our exercise regimen, gain a few pounds. But when would you consider having liposuction? I think if you are doing the best job that you reasonably can be expected to do, you're exercising as much as you can, and you might push for a week or two, but you're not going to maintain that. It's just not going to become your lifestyle. And you're generally watching your diet. You have not had a recent increase in your weight, perhaps due to laziness from not exercising or not eating healthfully, then consideration of liposuction is reasonable. We have to be pragmatic in this world, and not everybody's going to maintain an ideal weight, an ideal BMI. So if there's an area or a couple of areas that you just can't get the padding reduced, and you're reasonably close to what is practically optimal for you or realistically optimal for you, then it'll make you feel better to have the padding under your skin thinned, whether it be your arms, your neck, your stomach, hip rolls, which we call the grab handles, thighs, knees, even upper arms, then go for it. I think it's a reasonable thing to do. Don't see it, though, as a tool for weight loss. It really isn't. We don't take out that much weight. And remember, when I or your plastic surgeon tells you how much weight they've taken out, once the swelling's gone, you have to maintain that degree of weight loss, or else simply the volume's going to go somewhere else in your body. Maybe to an area that's favorable, maybe to multiple areas so that you don't really discern it, or maybe to an area that you really didn't want the fat to go. Could all go to your upper arms, where you've never really had a fat problem before, or to your upper stomach if the lower stomach was liposuction. So be careful. You have to take responsibility for the decision made in conjunction with your doctor, but make sure that you're doing it at a time where you're reasonably close to making as great an effort as you can reliably and in a way that you can maintain to be close to a good weight. Don't do it, of course, when you've just come through a birthday or been on a vacation, you've eaten poorly, and maybe you've had a spell, maybe you broke up with someone and you gained 10 or 15 pounds. That's not an appropriate time to undergo liposuction. Get the weight back off. If you simply can't, and there's an area that really bothers you, that's visible to others and bothersome to yourself, then consider liposuction, but make sure you accept the responsibility to keep that weight off so that that fat doesn't go to remaining fat cells in other areas of the body. Please visit my website, perlmanmd.com. Facebook page is plastic.surgery on Facebook. I also have a professional site on Facebook called Beverly Hills Plastic Surgeon Dr. Jon Perlman, where I do post a lot of health, beauty, and plastic surgical information that you'd probably find of interest. Thank you so much for listening. You can call us at 310-854-0031 if you'd like to make an appointment or find out more about liposuction or any other procedure that we perform. Have a great day. Keep up the good diet and exercise regimen. Be healthy. I look forward to meeting you in person. Bye-bye.